and disinformation can, can severely undermine public health efforts. Today's webinar brings together a community of practitioners, researchers, and advocates committed to advancing collaborative, evidence-based strategies for managing infodemics through network approaches. We hope that today's conversations will spark actionable insights, foster cross-sector collaborations, and strengthen our shared capacity to respond to information and disinformation with rigor, empathy, and innovation. Before we begin, let me go through a few housekeeping rules to help us have a smooth session. I'll kindly encourage all of us to share this link, tell people about the event, and stay in a location where you avoid distractions. And as much as possible, I encourage all of us to use the chat box to introduce ourselves. Tell us your name, your organization, and where you're joining us from. If you have questions for the speakers or the panelists, kindly drop them in the Q&A box and use the raise your hand feature if you want to ask a question. This session is recorded and will be made available to all registered participants after the event. Also, finally, I encourage all of us to share our reflections, our key takeaways online using the hashtag #HealthFactCheck. Once again, I want to thank you all for joining today, and we are really glad to have you. So to take us from here, I would kindly invite program manager, Habibat Lawal, to introduce our MD, who would give us the welcome address. So over to you, Habibat.
Yeah, thank you so much, Sunday, for just warming us up and giving us a few housekeeping rules and just like a brief introduction. Hello, hello. Good morning, good afternoon, good evening, wherever you're joining us from. We're so happy to have all of you here. I'm excited. Like, I've been waiting for this webinar and finally I'm here. So welcome to this very important webinar. So without wasting much time, we want to have our Managing Director at Nigerian Health Watch, Vivian, give us a welcome address before we kickstart. So over to you, Vivian.
Thank you very much, Habibat, and thank you for that brief introduction. It's really good to have a lot of you here with us this morning. Good morning to you all, and good afternoon, of course, for those of you who are joining us from a completely different time zone. For us, it's a real pleasure that we welcome you to this very important conversation on evidence-based frameworks for network infodemic management. We're so glad that you could join us today, and we hope this promises to be a thoughtful, practical, and very much needed discussion. We are very fortunate to be joined, as you see from the flyer, the banners, the distinguished speakers that have agreed to speak on this webinar today. They come with global and local perspectives, which we're really, really interested in hearing from. First of all, I am particularly excited to welcome our keynote speaker, Agri Aluso, someone who I've known through a lot of the work that he does at RANA. RANA, as some of you may know, is the Resilience Action Network for Africa. Agri is the Africa Director also of Pandemic Action Network. Also thrilled to have Elodie Ho, who is the coordinator of the Africa Infodemic Response Alliance, and of course, Michael Okali from our own NCDC. He is a risk communication and community engagement specialist. All of them bring with them some real practical experience from really the front line of infodemic response. So as you saw from the title of this webinar, Evidence-Based Frameworks for Network Infodemic Management, some of you may be asking, what really does that mean? So perhaps maybe I'll start from there and really break down what we actually mean by network infodemic management, especially for those who are hearing this for the very, very first time. Really, I think, simply put, what it means is how are we collectively across health systems, communities, media, and digital platforms. How are we identifying and understanding and responding to the spread of false or misleading health information? And it's said to be networked because the problem doesn't just rest in one area. As you see with the diverse range of speakers we have today, it really is a community effort. Not one single person has the solution. It really requires a coordinated approach. So different people working together across sectors, across geographies and digital spaces and physical spaces, collectively pushing back against misinformation in a timely and trusted way. And of course, providing what we say is, relevant information for the different audiences that we're trying to really speak to ultimately. So at Nigeria Health Watch, I cast my mind back to 2020, in a space where a time when many of you will recall the COVID pandemic had started. We witnessed how fast misinformation was spreading as fast as a virus, how quickly it could travel, and really how deeply it affected behavior, how it affected people's attitudes, and really ultimately how people's outcomes were also impacted by that spread of misinformation. And at that time, the WHO described the infodemic as an overabundance of information, some of it accurate, much of it actually not. And it really made it hard for people to know who to trust, what to trust. And I'm sure for you, it resonated in terms of how do we build those systems that enable people to trust information? And that, as an organization, really resonated for that. And we realized that managing epidemics was not simply about just correcting false claims or false information. It meant actually listening to what people were saying, identifying where the challenges were, what the confusion was, and really working with communities to build the trust from the ground up, ultimately. So this really was the birth of our health misinformation management project, Health Fact Check Niger, the hashtag we use for that project on our different communication platforms. We took a really proactive approach quite early on that was data-driven and community-centered, and it helped to track and respond to the spread of false health misinformation. And from using the different tools, we use social listening, both online and offline, running media campaigns. I remember at that time we would correct false misinformation and then use a multi-channel approach to disseminate the information, understanding that people don't just use one channel to access information, but really tapping into where do people get their information from and using those multiple channels to really distribute and share that information, from using online to using community voices, to using print, to using radio, really using those multiple channels that people have access to, and knowing that we have to use a disaggregated approach to communicating information. And that, is where we talk about that network approach, from working with influencers, health workers, and really the focus more than anything was then and currently will always be, how do we strengthen the flow of credible, evidence-based health information. So we did it through our fellowships. We support government agencies building up their capacity, the community engagement, which I spoke about. We really have seen firsthand how when you equip people at the front line of communication, from the health worker to the traditional leaders in communities, you can shift narratives and empower communities to make those healthier choices. So really, as WHO has consistently reminded us, trust is everything. And once trust is lost, it is incredibly hard to rebuild. The public is overwhelmed and uncertain about the right time, the right places to look for information. Rightfully, there's a lot of disinformation online. We see the impact that's having in many countries around uptake on vaccines, things we took for granted for many generations. They're looking for answers, but they're looking for an honest and empathetic voice to often guide them to where that information is. So today's discussion is especially our goal is for this webinar to really unpack what these frameworks look like. How can we apply them in practice? How can we make sure that they work across different settings, across different countries, geographies, continents, working together? So really, we hope that by the end of the session, I hope that you will walk away with a clearer understanding of what effective networked infodemic management really looks like, what's worked in different contexts, and how can we apply these lessons in our own individual work every single day. And more importantly, I hope it encourages, new collaboration, partnerships, definitely fresh ideas, and really a renewed commitment to ensure that we keep pushing to ensure that health communication is clear, credible, and is actively rooted in the people and the realities that we're trying to serve. So let me just close by saying that infodemic management, it's not a one-off campaign. It's not something that can operate in silos. It's not a one-off intervention. It's an ongoing process. And it really depends on listening deeply to what people are asking, acting quickly, not be done, as I said, in silos. We need to work collectively together across our different networks. So with that, I'd like to say thank you again for being here. Please do engage with one another, connect with one another. As we mentioned, introduce yourselves, drop your name in the chat box, tell us who you are, and ask the questions you need to the different speakers. So without further ado, welcome once again, and let's get started. Thank you.
Indeed. Thank you so much, Vivian. Let's get started. Thank you so much for the wonderful welcome address and for reminding us that indeed infodemic management is a coordinated response. So we move straight to our keynote address that is going to be given by our guest speaker, Agri Aluso. Before I invite Agri in, I'd like to just give you like a brief talk about bio about Agri and the work that he does and why he's very key to this important topic that we want to discuss. So Agri, as earlier introduced by Sunday and Vivian is Executive Director, Rana and Africa Director, Global Policy Lead, Pandemic Action Network. He is a seasoned global health leader with deep experience in advancing intersectional justice using citizen-led and rights-based approaches in Africa. He worked previously as a senior manager for the Open Society Initiative for East Africa. He provided oversight and thought leadership for Open Society Initiative's Health and Rights Program that is focused on addressing structural determinants of health in the Eastern and Southern African region. Agri has also coordinated the Open Society Africa, that's the Pan-Africa Vaccine Justice Program to bolster Africa's evolving work in advancing vaccine, which is related to research, development, and manufacturing. He has also served as the East African Policy and Advocacy Manager for the University of Manitoba's Global Institute for Public Health. And Agri holds a master's degree in gender and development from the University of Nairobi, a bachelor's degree from Egerton University, and certificate from INSEAD on leading for results and policy and legislative drafting from the University of Johannesburg, amongst others. Agri, it's such an honor and a privilege to have you be here to give us this keynote address on this very important topic. It's a privilege, it's an honor, and thank you so much for being here. Agri, over to you. Thank you.
Thank you, Habibat, and the Nigeria Health Watch colleagues. Good morning, good evening, colleagues. I could already see from the chat that we are from all parts of the world. I was just early this morning in Asia working group. By that time, it was 7 my time. It was about 2 their time. So that shows you how diverse our world is, and I'm happy that we have all colleagues and partners from that spread, global spread. And just to say that I think it's the honor and privilege is mine, Habibat, and Nigeria Health Watch team. I think we have had a very good working relationship. You are experts when it comes to these issues of communication. We try to bring communities and try to connect the dots across different issues, across different groups. And we rely on experts, on various thematic issues like health communication from, niche organizations like Nigeria Health Watch. So thank you so much for recognizing us and for giving me the opportunity to share with you some quick opening remarks. So I'm not an expert. That was my nice way of saying that. So we are a network organization, like has been ably said by Habibat. So I'm not going to belabor doing introduction, but just sharing some of our evolving lessons. And this is something, as Vivian highlighted, we have to be intentional about learning and putting those lessons into practice. And I think that's something we are very intentional about at Resilience Action Network Africa. The evolution from Pandemic Action Network Africa to Resilience Action Network Africa is one of those lessons that we learned. That we need to work at the intersection of several issues, because one issue is not isolated. We see pandemics, how it manifested. It's affected different aspects of our lives. Yet, for a very long time, we've struggled to just position it within health, and therefore we are moving into that space where we are recognizing that we need to bring all these structural determinants together and see how we can best make the world safe for everybody. And key in this is the issue of narratives and communications, because I think, as was ably demonstrated by COVID, having being on the side of the truth or having the facts from a scientific study does not guarantee that you have the right message. There are so many competing narratives there. And if you are not intentional about communicating it properly, then you may be the one struggling to be relevant. So I just wanted to start by sharing a quick experience that I had, and I'm humble enough to share this because it could have been an embarrassing experience for us, but I think we took it positively as a lesson. So I know many of you know about the recently concluded the Intergovernmental Negotiating Body for Pandemic Agreement, which we have been at the center of amongst many of our partners, some of whom are in this call, including Nigeria Health Watch. And we really were working to center the conversations around equity and drawing on the lessons we learned from COVID to come to bear into that agreement. And we were very confident we were on the right side of the narrative. So, in one of the events that we held on the sidelines of the negotiations, we managed to get an opportunity to bring the member state negotiators and the CSOs virtually joining and in person at Geneva. And I was moderating the session. And it was well planned. I mean, after my colleague here can tell it was well planned. We had figured out everything. We knew how it was going to run. And then when we started the conversations and did the introduction and now opened it up for people to chime in, the first 10 contributors were people who were actually there to, against the messaging. They are anti-treaty, anti-vaccine, and they were so coordinated. We were in shock. So we had to really go back quickly to our drawing board and, chat behind and say, like, how do we get this back? So we had to really do catch up and course correct, because we had not anticipated that somebody would come, with that kind of dedicated and synchronized misinformation, disinformation attack on something we thought was on the right side. So what we learned from that experience is that, no space is immune to misinformation and disinformation. No issue is too convincing and too right to be, subject to, these attacks from people who have other, ideas. And then, in this world where we live, in a very interconnected space, this information spread faster than even, the good things we are talking about, the vaccines, the policies, or the facts that we all know. And I think that's what the Dr. Tedros pointed out very well during the pandemic. Next slide. So I just wanted to share that. And I think as we confront these threats, we need a resilient system and intentional coordination, and this is a matter of urgency because we have people who are very intentional about spreading the wrong message. And we always assume if you have the right message, it will fly. In Swahili, we say, kizuri chajitembeza, kibaya chajiuza, which means good things sell themselves, bad things have to be sold by somebody. And that's exactly how disinformation and misinformation work. They know They have something that they have to really sell, and they are very intentional about selling it and getting ahead of you before you come with the right information. So what we learned is that misinformation is strategic and not random. Like people come and they sit somewhere. They must be having their. Sometimes it's random because somebody went with the wrong information, but you'd find a lot of times there are people who are very intentional about crafting certain information. You saw about the sovereignty challenge that WHO struggled with. People saying that they're usurping the powers of states to manage public health information and even impose sanctions, which was not true. But they struggled to do that. Nobody thought that anger would come. So that's a very sophisticated line of reasoning that you can't think somebody just figured it out on the move. Somebody thought down and sat down and thought of how to, really create an anti-WHO kind of sentiment using very sophisticated reasoning and twisting information to suit that end. And the messengers often carry institutional legitimacy, like what we saw in Geneva that day. The people who were speaking, they were doctors, they were academicians, they were people who have legitimate authority from their fields, from their disciplines. And like we really need truth and intentional storytelling to get our stories right, and we really need to connect with communities that are impacted, because when they get to them fast, whoever comes with the first information may get the best of the attention. So let's move to the next one. So just reflecting on that. So that brings me to the subject matter of today: why frameworks are important. Because we see the other side are very coordinated. And we often see if you have the right information, it will sell itself, like the Swahili saying says. It doesn't always happen like that. So we really need a coordinated multi-sector approach that can really anticipate and respond and preempt this misinformation and disinformation. That's something we have learned over time. And in a network model, it's many actors working towards a shared goal of creating a positive surround effect, of shaping a narrative that really drives the action in the direction that you want them to be driven. And as the initial speaker said, we saw Africa struggle with misinformation and disinformation impacting on its capacity to vaccinate the population. I think up to date, I don't know, I've not checked the latest statistics, but we still have very low infection. I've seen Nigeria with the malaria vaccine, disinformation and misinformation narratives. We saw that with the HPV, the one that was targeting girls, even recently, as recent as the other day. I don't want to mention, because when you talk about misinformation, it's like you're giving it food to fly as well. But you heard about a senior governmental officer in a very established democracy talk about Gavi, and basically use misinformation to attack vaccine initiatives in the world. So those are not things people just concoct on the move as they're driving to work. They're things they think about and they make them, and they're coordinated. And we have to match that level of intentionality with our own intentionality. So the networks give us that opportunity to be anticipatory, to plan in advance, and anticipate how these things usually unfold, so we go ahead of them and not wait to be reactionary and try to debunk what has already gone out there. So we need robust frameworks that really aligns with the values and goals across networks, provides consistency, because sometimes we have information that are not consistent, and that's what creates room for all this. And that really brings and centers coordination. It doesn't have to be a centralized messaging system, but it needs co-creation across different spaces in ways that build that consistent messaging line. And to help build that resilience, that's really the core of our identity as a Resilience Action Network. Next. Yeah, so just quick reflection. Structures prevent chaos, frameworks provide role clarity, and people knowing what to do in different scenarios before and after. And I think that's just something that cannot be overemphasized. Just wanted to refer to Ball and Maxmin in 2020. They did some good work, which really reflected on the scenario that we faced during COVID. And they reflected that the epic battle against coronavirus information and conspiracy theories was because of the absence of robust infodemic management framework, which significantly hindered effective pandemic preparedness and response during the COVID-19. So my Geneva experience really affirmed that we should never assume that when we're on the right side of the truth, our story will be good and convincing. That's something that I cannot overemphasize. We need to be proactive and not reactionary. I've said that. We need to be coordinated and have a unified narrative. Next. I know you didn't give me time, Habibat, but I know I need to wind up. So next, just run through the slides. I'll speak to them. So for just reflecting on our approach as runner and pan, what one thing that we do intentionally is distributed leadership. We have a network that does not centralize the narratives. We want to work with different leaders in different spaces. In Nigeria, with Nigeria Health Watch, in Senegal, in South Africa, in Kenya, and the communities that they come from, not even at the national level, so that we can have those unified approach that build on the local experiences, that build on the local reality, and not something that comes from a central point and therefore is seen as external narrative. Of course, we've worked on this over the years. We use the networked advocacy approach, and we use the same model in our management of misinformation and disinformation. And it's not us to do that, because even in our networking, we recognize the geographic distribution, which comes with the cultural diversity, and we also recognize the thematic distribution, which comes with the niche understanding of subject issues. Like, so when the space where Nigeria Health Watch is, we'll not be the experts. We'll work with them to generate that information so that they are able to really bring local ownership, help develop agile tools and consistent messaging, and really use feedback mechanism to react to test messaging over time in real time. Next. So just a quick example, we could just run through those, and just this was just some of the frameworks. So spaces where these have been used. So detection and intelligence, there was a very encouraging initiative by WHO ES program. Narrative development, I think this has been used by many of us, including Nigeria Health Watch. Amplified, amplifying work through our trusted knows pandemic action network used that, and a lot of our partners also use using trusted networks. And of course, one important thing that all of us use is evaluation and feedback, so that you keep on building and developing your narrative. So I think that should be like it. Just one quick examples which we all know about, like what happened in Nigeria. Just some of the examples I came across. Africa CDC, as many of you know, has this, and somebody I'm sure will be talking about that, so I'm not going to belabor, but just some of the examples that I think are encouraging, that help us really have a coordinated approach. So some of the recommendations as we move, build narrative labs, because I know the other side of actors do that. They come up with these things deliberately. We also need to do that. We need to pre-bank, not debunk, create clear escalation frameworks, and institutionalize network protocols. And I want to stop there and just leave you with that. That truth without structure can be drowned out. In the age of viral lies, coordination is not optional, it's our only defense. Thank you so much. Back to you,
Thank you so
Vibert.
much. Thank you so much, Agre. Thank you for charging us up and your wonderful keynote address. And I got some few points that I just wanted to emphasize for all of us to, just absorb them and think about them, and like a food for thought. And, later, if we have like any feedbacks or responses, we can, when it's time for that, we can have a discussion about it, which is that, that in infodemic management, it's not just infodemics is not random. It's mostly strategic, right? And we need to think about that. We need to think about that. It's not just something that just comes off. It's strategic, and there is no space that is immune to misinformation and disinformation. Where you gave us a good practical example at your experience at WHO in Geneva. And then you also are talking about, for us to push the truth, we need to be intentional about storytelling, about sharing our stories, and how important storytelling is in pushing out, the narratives that we want to be out there. And that, when we're talking about frameworks, which you've given us, you've done it so well by aligning how your experience at the Pandemic Action Network, and how you're able to translate that to a coordination when it comes to network infodemic management, saying that frameworks, they give us that coordination, and it ensures that our efforts are not scattered, they are not siloed, and that they are well structured. And then one of the things I also picked was also sharing, like, what are some of the things that we can look at when we want to when we're discussing frameworks for IM, and we have people coming together which is their goal is for infodemic management, is we need to have shared purpose, local ownership, agile tools, and with consistent, and I'm picking that word consistent. The messaging has to be consistent, and that we should also have feedback and learning loops. Thank you so much, Agri, for giving us that very insightful keynote address. I really took a lot, and I hope a lot of you have taken one or two things from Agri's talk. And then I hope that, I know there may be questions, there may be feedback. We'll have sessions for that. However, in case you don't want to forget, you might just go to the Q&A section and just put in your question, and then put who you want to address it, because we are about to move to a very, very important session, which is the panel discussion. Yes. And of which Agri is also going to be a part of it. But before we delve into the panel discussion, because we have experts here who are here to discuss with us, I would like to just give us a brief introduction of our other panelists that are here that will be joining Agri for the panel discussion. We have one of our panelists, is Elodie Ho. She is the coordinator for IRA. Elodie is also a social and behavioral change specialist. She has over 15 years of experience in leading emergency projects in Asia, Africa, and the Middle East. In 2021, at the height of the COVID-19 pandemic, Elodie joined the Africa Infodemic Response Alliance, a WHO-hosted network. In this role, she piloted infodemic management approaches in Africa to combat mis and disinformation and improve generally the information ecosystem. Elodie, of course, is a coordinator for IRA for the World Health Organization in the African region. In this capacity, she strives to foster collaboration and coordination among UN agencies, NGOs, and fact-checking organizations and research institutes to ensure accurate information, which is those who need it most. Thank you so much, Elodie, for accepting to be part of the panel discussion. I would also like to introduce our other panelists. We have with us Michael Obina Okali. He's the Risk Communication and Community Engagement RCC Specialist at NCDC, and is currently a Senior Health Communication Officer at NCDC, and he also coordinates the National RCC Technical Working Group with over 100 MDAs and partners across sectors. He played a pivotal role in responding to outbreaks like COVID-19, diphtheria, and mpox in the country. Michael has contributed to developing key communication strategies, including the National Multi-Hazard Risk Communication Guideline, a National Infodemic Guideline, and led one of the first community-led participatory needs assessment for Lassa fever under the COPE project, where he was awarded, wow, Chief of Health Promotion by Eze Ogowan of Orizu, Eza, local government in Ebonyi State. Now that's new, And he leads the RCCE pillar for the diphtheria and mpox IMS. His expertise in strategic leadership, in communication, and stakeholder coordination has strengthened RCC efforts and enhanced public health preparedness across the country. It is so nice to have you guys join us for this panel discussion. We have Elodie that is going to give us the African perspective, and Michael will also give us the Nigerian perspective. So Elodie, Michael, and Agri, welcome to the panel discussion.
Thank you very much, Habiba.
Yeah, Michael. Michael, can you hear? Michael, great. So we'll just start with the panel discussion, and then we'll have maybe Michael is having a bit of issues on his end. Okay, Michael, hi. Great. I think you're muted. Mhm.
All right, can you hear me now?
Yes, we can hear you. We can hear you. Thank you so much.
Thank you.
Thank you. All right, it's great. So we'll move straight to the panel discussion. Thank you for being here. So Elodie, you're the coordinator for IRA, and we just want to know what evidence based frameworks guides the alliance strategy for fostering, a coordinated multi-stakeholder response to infodemics across Africa. And how do you ensure that these frameworks are adaptable to diverse, contexts? Because, we have different contexts in different countries.
Thank you very much, Abibat, and thank you very much to the Nigeria Health Watch for the opportunity to share our experience. So for those who are not familiar with IRA, so we were launched in December 2020. And back then, there was no evidence, simply put, there was, or not enough to support, what we should do, how we should manage in a coordinated way, infodemic management. We were really at the heart of the storm. So basically, we had to figure out what works, what doesn't work through a period of trial and error and then adapting. But however, when IRA was launched, what we try to do is, first of all, trying to find a framework that will be simple enough and practical enough so then diverse countries could apply it. So if you check our website, our framework of intervention is adapted basically from the infodemic management process in public health, but simplified. So we have 4 pillars. The first one is to identify. The second one is to simplify. The third one is to amplify. And the fourth one is to quantify. So those 4 pillars were kind of the backbones of our interventions at the regional level, but also with the countries that we supported at the very beginning of the pandemic. So if I go, so what does it mean, identify? So it's not only social listening. I think I want to make that clear. Identify is really to understand the context, understand who is doing what and where, understand the ecosystem too, like how information circulates, not only misinformation, just information in general. Also, like what are the channels, trusted channels. So you borrow a lot from different disciplines, including RCC, to really understand how people get health information and what are the trusted messenger. I think this is a key point here. Then also like social listening is part of that. And I remember in the opening remarks, yes, online and offline. This is, I think, a basic rule. And we had to explain many, many times that we're looking at both. However, it is easier said than done. And I can go through that a bit later, but community feedback is actually quite challenging to include in the analysis because actually a lack of method sometimes or harmonized methods. Because you have to compare, when it comes to data, you have to compare apples and apples, So when the method is not necessarily the same or compatible, it makes the analysis and reporting very difficult and challenging. It doesn't mean that we should not try, but we bumped into many challenges in certain countries to do that actually, and to have harmonized tools. We're going to talk about tools a little bit later. Simplify is it's really simplifying what we want to do, the messages that we want to convey, the target audience. So here it's really like communication focused, at least at the beginning. It is not necessarily the case today, but really understand or strategize. As you said, it should not be random because you can waste a lot of resources and time. So it has to be a little bit more targeted. Amplifying now that you have a message, like the facts, how do you spread it through the trusted channels, and how do you reach the intended audience? And this is all, again, not necessarily easy, but this is also something that people need to take into account when trying to manage infodemics, because just having the facts or a fact sheet, for example, on the WHO website is not enough. It's clearly not enough, and people don't necessarily understand the language. They don't understand what it means. When you read a research paper, it's very hard actually to really understand the message here. So you really need to find a way to communicate effectively with the targeted audience, and quantifying that. I think this is the last pillar. And almost the most important one now that we are talking about evidence-based frameworks, because we are generating that evidence. It's still a very new field of study. So all of us are generating through a trial and errors and learning that evidence. So yeah, this is kind of the framework that I wanted to mention here. So back to you, Habiba.
Thank you so much, Elodie. Thank you for just giving us more context to the pillars: identify, simplify, amplify, and quantification. Thank you for digging deep and breaking it down so that we can understand what each pillar represents when it comes to infodemic management. I'd like to move to Michael now to give us a bit of, the Nigerian context. So, Michael, drawing from your experience at NCDC, what evidence-based risk communication frameworks have been, most impactful in building trust and countering misinformation within the Nigerian communities during health crisis? And what tools have you seen that have been essential for their implementation?
Thank you very much, Abibert. Lovely to be here. Greetings to all colleagues. Special greetings from Dr. Chide Idris, the Director General from NCDC, and to all colleagues that are here. So first of all, I have to apologize in case my voice is a little bit unstable. Right now, I am in Germany, Reims, the home of FLI, and the island is a little bit unstable in terms of network. So for the question, wonderful questions. And with the presentation so far, there's a whole lot of similarities coming on from the global aspect and both the country aspect. For NCDC has a mandate to detect, respond to diseases of public health emergency. And one of the strong approach to that is risk communication and community engagement, and plus infodemic management. So what we do in NCDC is for risk communication, we adopted the WHO integrated model for emergency risk communication that has 5 components. The components are risk communication systems, public communication, community engagement, stakeholders coordination, and also infodemic management. All these components fit into each other to supplement and also support each pillar. So for the systems, this is where we develop public health advisories during every disease outbreak and after disease outbreak. These public health advisories are meant to actually provide information to the public concerning the various disease outbreaks and how to prevent and how to report to the health facility. And we also develop training models that we give to experts that will also help them to empower or build the capacity of same community stakeholders all over the country. For public communication, this is where we conduct our community listening, infovigilance to actually hear the heartbeat of the community before now coming up with a way to analyze these data to come up with a message that will be audience specific and culturally sensitive. I will not go through all of them because of timing, but let me focus also on the stakeholder coordination component. This is where we have a very robust strength, where we identified almost 100 or 100 or 100 something MDAs that we work with in terms of multi-hazard risk communication. Here, we are not going risk communication for public health anymore. We've expanded to multi-hazard risk communication. We're talking about public health. We're talking about other hazards like volcano, wars, humanitarian crisis, and the rest. So what we tend to do here is to actually have a goal towards unifying messaging that will actually show that we have a unified front. Because one thing about trust is that if you are not actually convenient or it's not coming from the right structures, like the first presenter mentioned, that means the public would not respect what you are dishing out. So enough about that. Let me go into the second framework we have. The second framework we have is our strategic use of communication channels. So we adopt the PESO framework, which means the paid and shared and owned communication channel. For the paid model, this is where media houses, press actually invite us. Like NAN, we communicate with certain stakeholders in the Nigeria news agency, that can invite us to maybe any station to tell us to bring an expert that will speak on certain disease outbreak, and they will give us the airtime to be able to answer questions and also provide details. Then also for the end, that also happens. For the own, we also have our own platforms where we also send out messages. And if you see messages coming out from our platforms, the public know that yes, this is actually coming from the right source, from the right source. For the share, this is where we leverage on community platforms, communities like CSOs, CPAOs to also share our messages, and also seeing it coming from those platforms that have been trusted. Yes, that will actually encourage more trust. So these are one or two of the major frameworks we actually adopt in NCDC, and this has been working for us towards getting trust and also fighting misinformation, because we can't fight misinformation just NCDC. So we work with other stakeholders to expand our effect, our effort towards fighting misinformation and getting trust from the public. Thank you very much.
Thank you so much, Michael. I particularly like how you were able to like break it all down, in step by step in terms of the starting from the public health advisory that's being given in case of any disease outbreak, just to inform communities and the. And then you also made mention of, the training modules and stakeholder coordinations that deals with multi-hazard RCCE, and then your strategic use of communication channels. Thank you so much for that bit. I'd like to move to Agri now. Agri, we're not letting you go yet. I'd like to move to Agri. So I'm aware that the Pandemic Action Network has a technical working group that is focused on SBCC and infodemic management. So drawing from that experience, what would you say are the best practices and cross-country collaboration learnings that can be applied to in networked infodemic management?
Thank you, everybody. And I think I alluded to some of them in my earlier presentation, but I think picking on that particular point, one of the biggest lessons that we picked is what I call the distributed leadership, having different, recognizing the diversity of the space and the interest that we have in our space, and trying to have, a process that really builds on the local experience of our network in their spaces, with their experience wherever they are, and building on those in ways that, amplify the positive narrative that all of us are in agreement. We need to be clear on once we are clear, once we have the path of the narrative development that we want, and of course not being reactionary, as much as possible being proactive, then we make sure that we create necessary surround effect with the right voices using the right messengers in the different spaces, and that's where our distributed leadership model really came to working. So even within national spaces, even within regions like Africa or Asia, we had different voices that coordinated in really getting the gist of through the network that we were coordinating. We're able to agree on a broad path, not prescriptive, but a broad path of direction of travel, and then working within our different hubs to generate, messaging that resonate with the population and audiences in those particular spaces. Yeah. And of course, working with experts. So, like I said, a disclaimer. So, in our network, we have different experts, from different disciplines, but all of them have something to say. So, you cannot say communication experts are the ones who should do this. So, once we agree on a direction of travel, so different leaders, be they community health workers, be they leading scientists, be they communication experts like yourselves, or advocates, health advocates that have really been known to be pushing for certain positive messaging. Those are resources that now come in handy because people already trust them, and we build on that trust that they have built in the pre-pandemic time. Thank you.
Thank you, Agri, for bringing that fact that we need to sort of recognize the diversity and recognize that there are going to be different experts from different fields and looking for how to harmonize them, and also taking into consideration the local context and adapting that to whatever we're doing. Thank you for that insight. Moving back to you, Elodie. I like to, I know Ira does like a lot of, it's doing a beautiful work when it comes to, infodemic management and the coordination and all of that. But I would like to talk about the critical foundational tools and platforms that Ira leverages to facilitate effective information sharing, joint analysis, and collaborative action amongst its diverse member organizations. How does that work?
Yeah, that's a very good question. Thank you. And I think it's a very key question now that we have accumulated some knowledge about what works, what is feasible or not. Because as you said, what you asked me earlier too is how do we adapt to the local context? And it's not only like the cultural context, the language, it's also the resources and time that people have. And most of the time, it's very rare, actually, that you have someone paid full-time to deal with infodemic management. So you have to take that into account when you design tools, because that's a huge factor in like success or failure. So I think like for, when you go back to the framework that we still use actually until today is like, so the identify, how do we understand better the context? So we have the information ecosystem analysis that we adapted from different partners. So there's a version by Into News, there's a version from CDAC. So you have different methods that we kind of adapted for our use, our time and resources. So this is one of the tools that we use to inform the social listening work, and also like the recommendations that we provide. For the social listening, I think like social listening was kind of one of our strongest pillar or activity for a long time, and the most in demand. So for the social listening, for example, the first step was really to nail down the method. So what do we want to look at? The keywords, the tools also, because we had to look for tools that will work for our needs. We had to define a taxonomy. And again, like taxonomy, we had multiple examples, but we had to really simplify so then it could be adapted to different contexts. So for example, our current taxonomy has changed a lot from COVID-19 because we defined 5 main themes that can be applicable for multi-hazards. I think that Dr. Agre mentioned that it's very important now that we also look at beyond COVID-19, of course, but also beyond health. It could be climate and health. It could be different things. So we need to really have something simple enough that can be applied for different hazards. We have the taxonomy. We have a prioritization and categorization of the data, because there's so much out there. You have to choose, what you're going to focus on. And I think like one of the key message I want to say also with social listening is we have an action tracker tool. And over time, that action tracker tool has become actually the core tool that we're using today. We have a weekly meeting with the team, the social listening team, and they present for 20 minutes over like an hour. And the rest of the time, we talk about recommendations. And we talk about how are we going to follow up with the countries, with our partners on how to make those trends actionable. So we have that is actually one of the key tool that we are using right now. When you work with multiple partners from different agencies, including like especially the UN, because there's a lot of paperwork, a lot of bureaucracy, a lot of hierarchy that you have to take into account. So it's very important to formalize also the expectations and who does what, and data sharing. So we're still here, at the identify pillar. So sharing of data is not that easy, but we have an SOP. At least, for the online data, it's not necessarily the most challenging, but it's actually more for the community feedback data that we really need to agree on a certain process, because you have to take into account consent, informed consent from the people, how to protect the data, how to store. So all of this you have also to look into. The reporting, the format, the logos. Logos, you take a lot of time actually to talk with partners. Who wants his logo on the report? What size? What color? Everything. So these kind of things also you have to agree upon, and the format of the reporting, the content of the reporting, and then also, so this is kind of examples, but I think like what I would like to emphasize, I don't want to go too much into details. We have many tools, but I think one of the key challenge right now, it was the case during COVID-19, but it's even more pressing today, is coordination. And coordination, even beyond the health sector, I think, because I've been doing this job for since 2020, so for 5 years, and I've realized that we have a lot of things in common with the human rights sector. When we talk about disinformation and how it is organized, it's actually, they use many times the same tactics, and it's not just for health. So there is a lot of things that we can learn from different sectors. And now that we are talking more about building resilience to misinformation, disinformation, health literacy, we need to involve other actors like education. I saw amongst the participants of this webinar, there are people from the education sector. It's really critical to involve them more and more. Information, communication, technology with AI now. Like we have to involve them also in the discussions, because they are the specialists and experts in technology and how to use it. I attended a webinar from one of our fact-checking partners, and something struck me during the conversations. They were saying that mis and disinformation, there's no accountability for those who commit that, especially disinformation. So you need to look into the criminal system too. Like if there is no penalty, they will keep doing that, and will keep, trying to correct the information or pre-banking, but there is no accountability. So you also need to look into the criminal justice system of a country. So that's why I think like today, we really need to think beyond health and see how are the interoperability of our tools and how we can act together, against that threat, because it's honestly, it's beyond health. So I think I'm going to stop here, but happy to share more of our tools We have social media, of course. But I will just leave it here because I think there are also very interesting perspectives from Nigeria too. So over to you, Habibat.
Wow, thank you so much, Elodie. You've given us a lot to think about, and you just hit me with that. Like, come to think of it, what is the accountability, right? In terms of those that spread disinformation. If there is no accountability, it means we keep running in circles, running in circles. We keep doing this like unending. I think that is something that we really need to think about. And just breaking it down for us on how you're able to use the action tracker tool, because a lot of people say, well, you gather all this data. What are you going to use? What are you going to use it for? What is the next step after identifying and seeing all of these things? What do you do? Thank you so much for giving us that insight. I move to Michael. So I want to know how does the Nigeria Center for Disease Control and Prevention, how do they effectively collaborate with community leaders, civil society organizations, and the local media to sort of tailor and disseminate health messages? And we also want to look at the foundational tools. For example, let's say the community feedback mechanism. We can have shared communication protocols. How do they strengthen these partnerships?
Right. Thank you very much, everybody. Hope you can hear me.
Yes, I can hear you.
All right, thank you very much. Great insights from other panelists. Because it's looking like we actually practice and adopt same frameworks. So for stakeholders engagement, you agree with me that there has been no great achievement without collaboration. All great achievement would definitely have some collaboration in the background. And this is one strength of NCDC. And it cuts across all the departments, also to Nigeria, to risk communication and community engagement. Like I mentioned previously, we have a structure called the National Risk Communication Technical Working Group, where we identified sectors, a lot of stakeholders from different sectors. We're talking about education, we're talking about even security, the Nigerian police force, the military defense ministry, also the road safety. We're talking about agric, which is the agric animal health, and a lot of them. There were about 100 of them that we actually find it a little bit difficult coordinating if the funding and the capacity are actually not there. But over the years, we've been working with these stakeholders in terms of using our structures. When I say our structures, we mean that we might not have structures in certain areas, but those stakeholders we will work with, like NOA, National Orientation Agency, might have these structures. So what we do is that we leverage on the structures to gather information. So we don't normally act. Our RCC in Nigeria is data driven. We don't normally act or come up with strategies to address certain outbreak emergencies or crises. We need data to be able to inform. So what we do is that we leverage on these structures to collect those data, and we come together, analyze these data, and come up with the next action. This action will actually go through a lot of rigorous review from different sectors. So, for example, now the diphtheria 2023 that is also appearing now. During the outbreak, we were able to work with the Federal Ministry of Education, we were able to work with the Nigerian Civil Defense Force. So these are very strong stakeholders that we work with. So we have the structure at the national level, but we are not stopping there. At the last JE, it was recommended that we need to cascade the structures down to the subnational level. So we started working on it. Right now, we've successfully established the structure in Cross River State and also in FCT. And we are hoping that by maybe the end of this quarter, we have 2 more states added to it. It is a slow process due to the, sorry, permit me to mention traumatization or so due to that. So, but it's ongoing. So what we're trying to do to make sure that this stakeholder coordination actually trickles down to the subnational level. And apart from that, we also have platforms where we have our health health promotion officers at the state level. So these are also stakeholders that will also engage with in terms of identifying misinformation, addressing misinformation. These same health promotion officers also connect us with their structures down at the ward and community level. So you see how the flow goes. So we have at the national, those national stakeholders have structures at the states. We have structures at the state and also down to the community level. So it's a whole lot of unified effort, and we don't definitely do it alone. One major stakeholders that we work with in terms of addressing misinformation is the media. The media is a strong stakeholders. We don't overlook their participation or what they contribute to addressing misinformation. So we work closely with them because trust me, if you don't work with the media, definitely they are going to work against you, and you may not achieve what you're supposed to achieve. So some of the tools that we use in stakeholders coordination down to the state level one, the social media tool, social media platforms, and we also have social media platforms, and we also have other mechanisms that we use for feedback. And sorry, can you? So we also have other mechanisms that we use for feedback between we and the community stakeholders, and also other structures. Thank you very much. Hello, everybody. Hope you heard me.
Yes, Michael, I was able to hear you. I think your network did towards the end, but I'm able to get the NCDC approach in terms of the national, subnational, and how you're able to coordinate well with the media, the local media in all your responses, and then also involving the local context in terms of the community leaders as well. Thank you so much, Michael. I don't know if there's any other thing you would like to add.
No. So that is it. So just to prove to you that we don't do this alone. It's a unified effort, and it has been very productive, and we're still working on it. Our national multi-hazard document is actually another document that also help to build and strengthen the capacity of the state and community level in terms of a multi-hazard risk communication that also involves infodemic management and also how to address the public in terms of public health crisis. So these are some of the documents and some of the structures that we have existing. So we keep leveraging on this to see how far we go. Thank you.
Thank you so much, Michael. Thank you for giving us that angle. So I know I've been asking a lot of questions. Don't get tired. Elodie, I'm back to you again. I promise it's my final question. I want you to just discuss a bit, a significant collaborative achievement of IRA in combating an infodemic. And I want you to highlight how the Alliance Network approach and specific amplified and specific foundational tools amplify the impacts of the individual's members' efforts.
Yeah, thank you very much. And so I think if I want to highlight a good practice or a successful practice, I have few examples in mind, but I think like it's all related to understanding your network, who does what and who's good at what. And as a coordinator, there is a lot of personal interrelationship, with the representative of your network. And then this is how you are able to really quickly identify who you should talk to. Because I do remember during the COVID-19 pandemic, we were kind of prioritizing participation. So we were involving everybody in everything. And when you talk about a crisis it's very difficult then to have an effective and timely response or strategy. So I've learned over time also to really identify who does what, who is good at what, who is going to answer my question quickly, who wants what. I think like going back to what Michael was saying, working with the media, yes, definitely, but you need to understand also what they need from you and what you can bring to them and what you need from them too. I think this is a kind of negotiation that is very important, because one of the things that I've seen, and they told me, they don't necessarily need like a top-down approach where you just share the talking points and that's it. To me, that's not enough. That's not a proactive and collaborative partnership. And we had to deal with a crisis very recently, like I think it was mentioned during the opening remarks, coordinated attacks from public health authorities to kind of casting doubt on the safety of most vaccines, which is serious. So what we did is that basically we, or I would say as a coordinator, so first I asked my team to look at the problem. Okay, kind of try to break down the narrative here. And so then you have to take bits by bits, because sometimes the problem is a little bit too big to address at once. So analysis, understanding who speaks where, what are the arguments, and where we have some debunks or messages or facts. Mobilize the actors in your network or even beyond sometimes, depending on what you need. Like, for example, we had a meeting last week actually with one of our key partner, Code for Africa, who is specialized in disinformation. And what we wanted to discuss with them is actually to understand the network, because there is money behind those disinformation campaigns. There are champions. So can you help us understanding what the network looks like, especially in Africa? Where are the champions, the nodes, the channels? So then we can try to target with the little resources that we have. So then we are a little bit more effective than just mass communication and hope for the best. So after that, you mobilize also like the experts who can also provide some key information that the fact checkers need, for example, or the media need. And then also you mobilize like what we can do at IRA. We also produce social media videos, and we focus a lot now on explainers. So we identified in our social listening information gaps. So where people have a lot of questions, uncertainties, concerns, all these question marks basically in the conversations. And we focused on that, and we defined scripts, and we're producing actually videos to kind of address those questions before it blows up to something that we cannot really control anymore. So I think like this is kind of my my 2 cents here, is really understand your network, who does what, who is good at what. And WhatsApp is an amazing tool, also speaking about tools and sharing information. And also I think like the last piece is trying to document your experience. So then you can share it with others. We kind of neglected that aspect during emergencies because we didn't have the time and bandwidth to do that. But today, honestly, I think because what I've seen is that misinformation keeps repeating itself every time. It's like cyclical. Disinformation you can almost predict sometimes when we have a calendar with key events, so you can predict a little bit. So use those things, those experiences, to try to anticipate as much as possible and mobilize the people ahead of time, because the challenge is that people, unfortunately, sometimes they only act when there's a crisis, and they don't necessarily take the preparation and planning phase seriously enough. So yeah, this is a big part of my job actually, is really to to explain why we want to plan ahead of time, and also explain the threats and the potential impact of what we're seeing online and offline. So I hope it answers your question, Habibat, but happy to chat also afterwards. I see a lot of very good point in the chat. So yeah, but back to you.
Yeah, thank you so much, Elodie. You've given us a lot to think about in terms of when we are having different organizations, different experts together. It's not just about just involving everybody. It's about, being strategic in who you involve, and also being thoughtful about where they are meant to act, their different roles, and also think about it in the aspect of what they will also need from us and what is helpful to them. In terms of when you talked about the media, it's not just about sharing everything. It's about knowing what they need from us and being able to identify that and making our responses more targeted with the little resources that is made available to us. And I think one key point you also talked about was looking at the structures. We never really think about looking at, okay, so with all this misinformation that is strategic, it's good for us to also look at, what are their various structures and strategies that they're using, and the support and all of that could also help in our targeted response. So we're moving straight to the Q&A. I just want to use the opportunity to thank all the panelists. Thank you, Agri. Thank you, Elodie. Thank you, Michael. So much to think about from the discussions and the sessions. And I know I'm seeing a lot of questions. I just hope time permits. But I'll start with Rachel's question to Agri. So Rachel wants to know, how can coordinated network models help counter strategic disinformation? And what lessons can public health actors draw from your experience at global negotiations? Agri.
Thank you so much. Yeah, I think that's really the essence of us sharing this experience. What we, I think, all in agreement, all the speakers here, is that misinformation and disinformation, it doesn't come from one point. It's not a one person. It's not a one sector. It's not a one country kind of an issue. And because it comes from different points and it can spread very quickly, we need to be able to tap onto the infrastructure that we develop, the social and human infrastructure that we develop to move ahead of it. And so what we benefit from, what we have seen works in our favor at Resilience Action Network Africa and PAN, we have developed this network of trusted actors working on advocacy and policy issues. And it's the same actors that are dealing with the issues of misinformation and disinformation, whose work are impacted by the same. And we have many more that we are probably not working with. So we use that same strategy, that snowball effect, to use the people we're working with to become advocates or to become agents of the right information, because we don't want to be reactionary. So we try as much as possible. And we have had like so many working groups, and it was intentional. So we had, like Habibat mentioned earlier, we had behavior change communication working group. We had, of course, the overall PPR working group. We had, a few more others, regional working groups in Africa, in Asia, in Europe. So we use these different networks and we cross-pollinate, the challenges that we are dealing with, and really, really building on that element I was talking about the distributed leadership, to really create points of positive influence within our network, so that they're able to seed that right narrative and able to amplify it, as as Elodie mentioned. Because I think that's very important, because it's not about knowing what is being said wrong. It's about detecting early and being able to develop your communication early enough, so that when they're coming, people have the right information. And that network that we develop in peacetime usually come in very handy. instead of now waiting for things to happen, writing wrong information circulating, and then you start responding. We probably need to be more intentional about using the period that we have, when we don't have those crises to develop those trust, and use that when now we need to respond or when we need to act proactively. Thank you.
Thank you, Agbe. So there's a question for Elodie. So Okechi wants to know, how does IRA measure the impact of of your responses across countries in Africa?
Yeah, thank you. I think it's a $1 million question. But no, so our M&E framework evolved over time. I think we need to be also realistic about what we can measure and what we cannot. So at the beginning, we were very much focused on communication. So our indicators of success, especially on social media platform, were measured by the level of engagement, level of interaction, number of views, number of likes, things that you can measure with the social media platforms. We were not very satisfied with that, because it's not because 80 million people viewed your video that they're going to change their mind or believe what you're saying or remember it. So you have also to include indicators that you can inform. So you can collect the data to inform those indicators. So when it comes to social behavior change, you have to be very specific about the type of behavior that you want to measure. And we did some mass communication campaigns with Facebook, and we had what we call the brand lift study. And the brand lift study that was conducted with Facebook is to measure, you don't have a lot of room, but you measure 5 or 4 indicators. And one of them was the number of recall. You have a pre and post assessment, and you have a control and test group. So the methodology, you design it with Facebook, and then you have to pick your indicators. And one of them was the recall, after they see a message and before. There was also the level of knowledge, so increasing awareness about a topic. So you have to really be realistic about what you can do. And I think it depends on the objective too of your program. So for example, when we talk about strengthening systems, because we do social listening, but we work a lot with countries to strengthen their resilience and infodemic management systems. So key indicator for it's the existence of a coordination group in one context. And so you can measure it with TORs, is there a TOR existing? Is the group functioning? So basically you have your project objectives, and you define the different indicators. It's better if you have a theory of change, of course. It's not always possible, but it's better if you have. So then you can compile all this and try to figure out where exactly you had an impact or not. And for example, something that we cannot measure is for misinformation and disinformation is, have we stopped the disinformation from circulating? This is not part of our M&E framework because we cannot measure it. So, you have to be very intentional also what you want to measure and what others are measuring. I think we're going back to the network. A lot of other agencies are better than us to measure social behavior change indicators beyond knowledge. So I think you have to really see what the others are collecting, not to overburden also your counterparts in the countries. And then, compile all those indicators and data, and then see what you can justify. But yeah.
Thank you so much, Elodie. Oh my God, we have a whole lot of questions, but I'm only going to take one more question and then would call it a day because of time. Sincere apologies to anyone that have sort of missed your questions. We really apologize. We're running out of time. I'll just take Moyo's question on, it's just a general question. So I think anybody can answer if there's a response. So Moyo is saying there's been a sudden cessation of, cessation of external donor HIV and TB funding, and there's been a lot of misinformation about donor behaviors and recipient country communities. So what's our comment on that? I want to know our comment on that. And we seem to only reference COVID-19 frequently. So what's the landscape of infodemics around the top priority health problems in Africa, looking at HIV, TB, malaria, sexually transmitted infections, and non-communicable disease? I don't know if anybody has a response to Moyo's question. Anybody would like to say something?
Could you repeat it?
So Moyo is saying that, of course, there's been a sudden cease of external donors for HIV and TB, and there's been a lot of misinformation about, the donor behaviors, and also misinformation about, the recipient country community. Moyo wants to know what our comment is on that, and is also concerned that we only seem to only reference COVID-19 frequently. So wants to know the landscape of infodemics around other top priority health problems in Africa, like the HIV, TB, malaria, STIs, and the non-communicable disease.
Yeah, I could give it a shot, and I think
Thank you, Agri.
I think there are as many possible good answers as all of us in this call. I think yeah, that has been a turning point for all of us. It's an issue that has really elicited a lot of discussions, both positive reflective discussions from our end. I think one pivotal thing, and I wouldn't categorize all the conversation around it to having been misinformation. I think it probably was a good point of reflection. And I have had the opportunity to have deliberate conversations with a number of stakeholders around it. And the feeling is like it did not happen right, the procedurally, but it is something that we should have anticipated, particularly those of us on LMIC side, that we were banking very, very critical health financing obligations at a very high level, very, very huge dependency on critical health issues that was not healthy. That has been a key reflection in a number of conversations. And that our leadership should have foreseen this and acted proactively. But I think where we find ourselves is we have existential threats, particularly people who have been on life-saving medications who now there's no clear pathway in terms of how this can be turned around as quickly as possible to meet the need. But I think what we are now seeing is now a sustained conversation, both on the donor side, and there are a lot of misinformation on either side, as he rightfully says, with some of the misinformation being that a lot of the monies that are being given in terms of aid for health has nothing that benefits the other side of the world, which we know is not true. Because we just did a conversation on the sidelines of FFD4 on the returns to ODA, and taking the example of Europe, and it is huge. Everybody benefits, even if it's not just about global health security being bolstered, and people don't have to look at the back of their shoulders every other time. But I think even just in terms of direct returns and the benefits that accrue when people are able to be productive and healthy and doing business with each other. So it's something that requires another whole session like this, and I'm sure there are lots of such conversations being planned. And I invite colleagues to be more proactive. So I think this is a moment, it's a reckoning moment for us, particularly those in Africa, and we have to take the bull by its horn and use this as a pivotal moment to really drive a clear agenda for the future, a different future for our health financing as Africans. Thank you.
And thank you, Agri. Thank you for, just speaking to that question that was asked by Moyo. And I really want to apologize. I'm seeing a lot of questions, but unfortunately, because of time, and I think Agri also has other commitments that he has to join. We sincerely apologize, and I'm seriously sorry if I'm unable to, um, um, you know, ask your question. We apologize for that. We also have to look at maybe extending the time for the next webinar. I just want to thank everyone. I want to thank you all for the wonderful discussion. I want to thank you so much, Agri. Thank you for availing yourself, choosing to, speak to us. It's been an insightful, conversation with you, Elodie. I mean, just bringing that the African's perspective and the IRA and the work that you do, it's wonderful, and just giving us a lot of things to think about. And Michael for sharing the Nigerian context with us, and how NCDC is doing the work that they are doing as regards infodemic management. I really want to say that I've really had a lot of things to think about, things to talk about, things to see what we can do when we decide to come together. In terms of infodemic management, looking at the network approaches, and you've really given us things to look for, and how these frameworks can be designed. So this is not the end. I want to say this is not the end for these discussions. We have our health information disorder and infodemic management network that that we have, and would like you to be part of that network, because when you are part of that network, we can put all the conversations and all the things that have been given to us, things that, and apply it here. So we've shared the link. You can go, move around the site, check what we're doing. You can also, there's a place where you can, request to be part of the network, and then you're instantly added. So please explore our work and see what we have been doing, and be part of that network for us to, advance the work we're doing here on IM at Nigerian Health Watch. Thank you all. Thank you all for sticking to the end, for being here. I appreciate every one of you, the speakers, the panelists. Thank you so much for being here. This is the end, sadly. I don't know. Sadly for me, this is the end, because I was having so much fun. Sadly, this is the end, but of course the discussion continues. I will hand over to my colleague Sunday, who will be taking pictures. So please put on your cameras. Let's just take a picture, a quick picture. We talked about documentation. So we need a picture to say I was here at this webinar. And of course, we're going to be showing, giving certificates of attendance. So yay. Thank you, Nigerian Health Watch, for providing us a certificate of attendance. So there's going to be a certificate of attendance. So please put on your cameras. Let's document that you actually attended this webinar. So we hand over to Sunday. Thank you all.
All right, thank you so much, Habiba, and thank you all our panelists. It was really a great webinar, I would say. And please let's kindly engage more. The conversations don't just end here. We have an active X account that we can all engage in. It's Health Fact Check NG. So you can just follow us. The conversation continues on our platforms, and we are happy to respond to all your questions. Like Habiba said, we'll be sharing the recordings from this webinar, as well as some of the responses to the questions as well. So thank you very much. So can we all smile for the camera? but at least some people haven't got their video on yet. All right. All right. Thank you very much, everyone. And over to Abibat for any final thoughts.
So the final thought is I'm leaving you with the music. So enjoy the music while you sail away. Thank you all. Thank you.